Hey guys, I'm Dr. Ryan England. I'm a pediatrician here at Pediatric Associates of Auburn. I want to take just a minute to talk to you about anxiety and depression. So, as Rusty said, this past week, anxiety and depression are incredibly common in the population, and very few people, 40% of those who are struggling with anxiety and depression, don't seek treatment, specifically in kids, which is the patient population that I am honored to take care of. 1 in 5 will struggle with anxiety or depression during their adolescence. And we know that children as young as 2 can have anxiety disorders. So this is a very important and relevant topic, and I'm very thankful that our church has decided to spend some time on it. I want to take a minute to talk about the neurophysiology, or what's going on in the brain of folks struggling with anxiety and depression. I think it really helps us put this disorder into perspective and to understand that this is a very real medical diagnosis, and one that I want to encourage you, if you're struggling with, to reach out to others for help to deal with. So in the brain, we have neurons. Those are our little things in our brain that transmit signals, okay, that our thought processes, our feelings, all of those things are going to travel through our neurons in our brain, our thoughts, our hopes, our dreams. And each of our neurons meets at a synapse, and a synapse is how that signal travels from one neuron to another. It's like the plug, okay? You're plugging it in, and that's how those electricity in your wall or neurotransmitters transmit themselves or travel around your brain. The synapse meet in what's called a synaptic junction. So this is my fantastic artist rendering of a synaptic junction. So there you can see that this person has a very normal range of emotions, hence my rainbow confetti. And they have receptors, appropriate receptors. So we've got little vacuoles inside of the neuron that contain the different manufactured neurotransmitters within the cell. Those neurotransmitters go into the synaptic junction as the vacuoles release them, and then they travel to the appropriate receptor on the next part of the synapse. And from there, they generate various feelings. So in a healthy brain, you're going to have lots of different neurotransmitters generating lots of signals. So you want to have a range of emotions, okay? You want to have your rainbow of emotions. You want to be happy. You want to have a little sadness every now and then to balance it out. You want to feel contented, but it's okay to worry sometimes, to get nervous before a test, those kinds of things. So sometimes that nervous energy makes us function a little better. So very important to have this diverse range of neurotransmitters in a brain. When a person feels anxious, occasionally, you may get a little more with, say, the blue neurotransmitter. Or if you're feeling a little sad because your family dog passed away, you're going to get a little more of that blue neurotransmitter, and that's okay. Your brain helps balance it out. But if those feelings of anxiety or sadness really start to persist, and you begin to manufacture more and more of those hormones, your brain has to figure out what to do with them. So it begins to make, we're just going to say blue is your sadness or anxiousness neurotransmitter. It begins to make a lot more of those receptors, and it manufactures those receptors so that it can deal with all the hormones. They got to go somewhere, so your brain makes more receptors to put them away. It's like making more baskets to put the balls in, to clean up your kids' toy room if your kids are anything like mine. So, all right, so here's a brain where this person has been feeling very anxious or very sad, and that sadness has just continued to perpetuate. They're making a lot of those neurotransmitters that cause those feelings. The synaptic junction has become flooded with them, and the brain has become saturated with the receptors to deal with them. So this is the brain of a person who feels sad. So there's no room for all of the other things in their life. There's no room in the brain for them to feel peaceful, to feel the love of Christ, to feel joy and love, to feel happiness and contentedness from relationships. Their brain is so cloudy with all of those negative emotion neurotransmitters. There are several ways that we can address this, and the first is definitely to pray about it. So you want to reach out to the Lord and find peace and comfort in Him. After we've done that, we want to get some sort of treatment to help rebalance the brain. So options for that are cognitive behavioral therapy, which is consistent, persistent therapy through a cognitive behavioral therapist. You want to make sure you find someone who is appropriately trained, or using medications to help readjust those chemicals in the brain so that we can go back to a well-balanced brain with all of our joy and appropriate emotions still present. So over extensive presence of neurotransmitters in the brain that cause feelings of sadness and depression are what result in these anxiety disorders and depression disorders that are so common in our population. And we need to make sure that we're addressing them appropriately. When your brain is so full of these neurotransmitters that causes anxiety and depression, those other emotions just can't get in, and that's really detrimental to a life course. So we want to make sure that we're getting these things appropriately adjusted. Pray first is always the motto, but recognize that in this situation, you're likely going to need additional help. Please reach out to your physicians, reach out to your certified cognitive behavioral therapist. Call any of the numbers that Rusty has given you, and please get appropriate help. Understand that this is a true medical diagnosis, and that simply praying about it and not taking additional steps to therapy may not resolve it. I know the Lord can do really wonderful and powerful things, but we want to make sure that we're taking care of our end of the deal too. So reach out for your physician. I know they'd love to see you. I'd be happy to see any of your kids anytime who are struggling. Give us a call. Thanks. Bye-bye.